do you want me to introduce you? Yeah. Well, this can, yeah. Does this work? Yeah. Okay. Good morning, everyone. Thank you for joining us here for the SIWI Seminar series on water actions for health and climate resilience. I want to say thank you for everyone joining us in the room, but also to all the participants online. We're really glad that you're with us. So my name is Isabel Heetke, and I'm part of the scientific program committee. I've been working alongside Aaron Salzberg to put this seminar series in place for the last few months. And we've been working together with several co-convening organizations who helped us along the way and really carried a lot of the work. So I want to thank Amref Health Africa, the Commonwealth Secretariat, the Ministry of Foreign Affairs, Government of the Netherlands, WHO, UNICEF, IFRC. So thank you so much. So this, as said before, is part of a seminar series on water actions for health and climate resilience. And we met for the first time on Sunday. I don't know if anyone here joined us, but we had a fully online session to look at the evidence behind water, climate, and health, and how these three parts are really interconnected to one another. And today we're taking this to the next level because we don't just want to see water as the victim of all the challenges that we face, but we want to see it as a catalyst for solutions as well. So we're trying to see now this within the seminar series within the next 1.5 hours, what actions are already out there to build climate and health resilience. So we're really excited for that. And this is also not the last part of the seminar series because tomorrow morning we'll meet for looking or taking that to the next step and looking how we can engage political leaders, look at financial resources, and also what kind of indicators we need when we look at water, health, and climate. But without further ado, I would now like to welcome Nanneke Nix to the stage. She'll be the moderator for today's session. She's from Amref Health Africa with over 25 years of experience working with NGOs. And she's the, let me show the screen, sorry about that. She's the manager of the future programs, and we're really happy to have you here. Thank you, Nanneke.
Thank you all. Thank you, Isabel. So Sunday we met actually with several panelists, as Isabel also said, and there's overwhelming evidence that climate change is taking place. And we don't need to repeat that. The evidence is there, but we don't always have the evidence for how should we work on the nexus, which interventions in the nexus of climate change, health and water actually work. What evidence do we have there? So we're going to talk more about that. What actions are we seeing on the ground? And we have a diversity of panelists here. So we have academics, we have people from NGOs, and we have people from government, and they know really what's going on there. So they will share their experience. So I hope it will be a day full of learning. We will first now start with Aaron Jenkins. He is actually calling in from Australia. We are having a very diverse panel, also not only from Australia, but there are also people from the Caribbean, Shane and Christopher. You will meet them later on, and they are actually calling in from the Caribbean, and it's 3 o'clock in the night there, so bear with them. I am really glad and very proud that they're here. Of course, online. That's also what I want to say. Most of our participants are online. We are doing that also to show the broad perspectives, to be inclusive. There are quite some chats and questions also there on the chat, and Isabel will moderate that. But first, Aaron. Hi, Aaron. Good to see you again. Aaron is leading the Pacific Planetary Health Hub in Australia, and he is doing that within the infectious disease hub. So he knows both sides of the whip. And you will give a brief overview of what happened last Sunday, and you will also kick off with some experiences. So Aaron, over to you.
Thank you. Can you hear me okay? Yep.
Yes.
Well,
yes, we hear you.
Good morning, ladies and gentlemen. I'm very pleased to have this opportunity to present to you and recap from Sunday. I'm Eastern European and Native North American Cherokee descent, and I've lived and worked for decades with the communities of the Pacific Islands, particularly on integrated watershed management for overall systems health. And I'm an associate professor at University of Sydney, and I really specialize in eco-epidemiology and planetary health. And I focus specifically at this intersection of ecology, infectious disease, and sustainable development, with a particular expertise in wetlands management, water, sanitation, hygiene, and the impacts of environmental change, especially climate and environmental change on health and downstream systems. So, as was said, this is a 3-session series, and on Sunday, the first of the series really set the tone for our week together. Where we're reminded that climate change is really not a future scenario. It's a present reality. It's reshaping our water, our food, and our health. We had Amir Delju from World Meteorological Organization lay out the science. Last year was the hottest year on record. Sea levels continue to rise at record pace, and nearly half of the world's rivers were in low flow conditions. These are all signals that our hydrological foundations are shifting with profound consequences for human well-being. The panel then brought these global signals into a lived experience. Megan Bailey showed how fragile our water and sanitation systems are. When water runs scarce, hygiene drops and disease starts to spread. Martin Muchangi stressed that we can't keep working in silos. Droughts, floods, and cholera outbreaks don't respect sectoral boundaries, and neither should we. Pamela Katic highlighted how climate extremes are eroding food security and nutrition, with the poorest bearing the heaviest burden. But she also gave us hope, showing how some Indigenous-led climate-smart agriculture can help restore resilience. Ronald Rup-Narine showed a Caribbean perspective on cascading crises, hurricanes, volcanic eruptions, pandemics, and emphasized that communities are not powerless, that local action is important and matters. And Janice Lee invited us to view water not just as a resource, but as culture, history, and story, reminding us that Indigenous and artistic perspectives are powerful drivers of adaptation. 3 kind of key messages emerged for me. First, we can't work in silos. Second, we have to value the lived experience and the Indigenous knowledge equally alongside the science. And third, we must act now to scale up our proven interventions, improve climate literacy, and build the resilience before the next crisis hits. Bruce Gordon from WHO closed by reminding us that sound science paired with collaborative action is our best tool to protect human health in a changing climate. And so this brings me directly to the theme of my talk, which is climate change, catchments, and contagion. And what we heard in the past sessions resonates deeply with this work that I've been part of across Pacific watersheds. And I think that, if climate change is the great destabilizer, then watersheds offer us a scale where ecosystems, communities, and health come together. So I'll take you on a little journey exploring how protecting the health of our watersheds is inseparable from protecting the health of our people. So there's our first slide. The next slide. Yes, that's it. You've got it. So climate change basically increases the risk of almost every form of human suffering: infectious disease, chronic disease, poor mental health, injuries, and disrupted lives. The effects operate through, of course, various complex pathways, some direct, others indirect. Not everybody is equally vulnerable. Wealthy nations are far more resilient than poor nations. Within any country or community, poorer people are more vulnerable than those who are better off. Certain subpopulations are particularly vulnerable. These are children, older adults, and people with particular medical conditions. And of course, future generations, given the trajectory of climate change, will be more vulnerable than those of us alive today. Although the health threats are clearly manifesting now, they're certain to worsen in the future as climate change progresses. Next slide, please. And nowhere is that more evident than in the Pacific, where several towns in Fiji, for example, such as here in the town of Bar post-cyclone Patricia, and Nandi towns flooding with increasing frequency as more rainfall, larger cyclones, and denuded watershed systems collude to co-create this increasingly common perfect storm of conditions. Apart from the immediate deaths and displacement and damage to infrastructure, there's also this ongoing increased risk of waterborne enteric diseases, particularly such as typhoid fever and leptospirosis, and also improved conditions for vector-borne disease proliferation. And in this context, the theme of this talk, entitled Climate Change, Catchments and Contagions, is particularly pertinent. Next slide, please. We've identified that at least 58% of human pathogenic disease are exacerbated by climate change. This is a recent study by Mora et al. That identified over 1,000 unique pathways through which climate hazards aggravate disease via warming, floods, droughts, and other mechanisms. Next slide, please. It's important, however, to recognize climate change doesn't occur in a vacuum. It's important from the outset that we don't conflate environmental and climate change. Let's be clear, climate change is primarily driven by human-induced greenhouse gas emissions. It's long-term shifts in global or regional weather patterns. Environmental change is a much broader range of transformations in Earth's natural systems, including deforestation, biodiversity loss, pollution, and soil degradation. And climate change interacts with these other transformations, but it's a subset of environmental change overall. And acknowledging this distinction is very crucial for our informed discourse. It's crucial for designing the appropriate inventions and fostering the kind of interdisciplinary collaborations that we need for this to work. Climate change interventions, they focus primarily on reducing greenhouse gas emissions, transitioning to renewable energy, increasing resilience to extreme weather events, but addressing environmental changes has a much broader range of actions like habitat restoration, pollution control, sustainable resource management. And despite these differences, there's the complex nested interactions and feedbacks between these phenomena that make it important to have a comprehensive approach to address both climate and other environmental changes to ensure a sustainable future for our planet and the health of our people. Next slide, please. This recent paper emphasizes the interconnected pathways, as I've been just talking about, by which global drivers of climate change, biodiversity loss, land use change, and pollution all collectively amplify infectious disease risk across humans, wildlife, and ecosystems, creating these complex feedback loops. And this really highlights that addressing any single driver in isolation risks exacerbating others, or underscoring the need, which underscores the need for this integrated systems-based approaches. This paper argues for a coordinated and interdisciplinary research to mitigate these interlinked pressures and to emphasize the potential for co-benefits, and those co-benefits that enhance both the human well-being and ecosystem resilience. So this brings me to my project, next slide please, which is this transformative and highly innovative watershed interventions for systems health program, which I've been involved in, which uses watersheds, also known as catchments or river basins, as focal point for health and well-being. Next slide, please. We have to recognize watersheds as an effective place-based unit that offers a coherent and ecologically representative system in which to address multiple environmental, socioeconomic, and health objectives together, linked to achieving the SDGs. So what happens in the entire watershed influences the health and well-being of inhabitants, downstream users, and the biodiversity. Downstream demand for food, water, and resources drives the upstream activities as a positive or a negative feedback cycle. And this entire watershed is a nested system owing to its distinct and separate subsystems. And many of the SDGs are thereby embedded, and cross-sectoral attention is necessary. Next slide, please. So climate projections suggest that much of the Asia Pacific region where I work will experience greater intensity and frequency of days with extreme rainfall and an increase in the proportion of severe storms. This means greater flood risk impacts on watersheds that have been highly modified. And our team has produced this body of evidence from Melanesia that shows that reduction in nature's buffering and regulating systems within watersheds negatively affects downstream freshwater and marine resources on which people depend on for subsistence, livelihoods, cultural practice. We've also shown that some of the same watershed changes, such as fragmentation of the riparian zones along rivers, clearing on areas with highly erodible soil, for example, are all associated with the incidence of climate-sensitive water-related bacterial diseases such as typhoid. So our published model indicates that the interactions between extreme rainfall and storm events and watershed modification produces ill health to people and nature through these three non-exclusive pathways of damage to existing water and sanitation infrastructure from floodwaters, crowding of people and animals together during flooding, and poor water quality through increased sediments, nutrients, and pathogens in river runoff. Next slide. Our WISH program of work is focused on 5 watersheds in 29 rural communities with high burdens of at least 2 of these, what they call the 3 plagues in the Pacific, which is typhoid, leptospirosis, and dengue. Next slide, please. So this WISH Fiji project had a 7-step adaptive management process to address these nested risks across the watershed scale, community scale, and household. And this process began with participatory watershed selection, integrating the national workshops and stakeholder input, which is step 1, followed by a community level engagement through a long and arduous and important free, prior, and informed consent process to prioritize the local needs, which is step 2. Data collection and risk assessments were step 3 through 5. Informed, tailored interventions supported by communication tools and community-driven water and sanitation safety planning, which is 6 and 7. And then we address these interlinked socio-ecological factors at multiple different scales.
Aaron?
And
Aaron,
yes?
we are seeing your screen and we are hearing you, but we don't see you anymore. Is it possible for you to turn on your camera again? So it would be nice, then we can also see you.
Oh, sorry, I didn't realize that my camera had gone off.
Yes,
sorry,
now we can see you again. Yes, thanks, great.
Sorry. So if we address these interlinked socio-ecological factors at different scales, it ensures that you have very context-specific iterative responses to mitigate water and sanitation-related health risks. And here, what we can see is a table. It's a risk factor table at different nested scales. And you can see watershed scale, you can see community scale, you can see household, and you can see individual. And these are risks for systems health that are acting, where they're acting, and where they're common for multiple diseases. And you see the LTD and CD there. That's leptospirosis, typhoid, dengue, and coral disease downstream. And you can see that there's clear efficiencies to be gained by acting where those yellow arrows are, where the risks, acting on the risks at multiple different nested scales and where the risks are common to multiple diseases. So you can modify environmental risks at different scales nested within watersheds and be addressing multiple outbreak-prone diseases and downstream eco-health at the same time. Next slide, please. Our results in phase 1 highlight significant cross-sectoral risks and interventions, with sanitation safety, water quality, and land use management emerging as critical areas of focus across the 5 watersheds. poor sanitation infrastructure, E. coli contamination in water, proximity to swamps and livestock in and around water sources posed high risks to many communities, guiding the prioritization of our interventions. We had 339 interventions overall spanning water systems, land management, waste management. Notably, we had 168 interventions that we implemented specifically, with water systems being the most common, 31.8%, integrated planning being the most, also one of the most addressed categories. And this involved collaboration across government, NGOs, local communities. This adaptive management approach also emphasized gender inclusion, and we've got 69% of our water communities increasing the amount of women's participation. And then next slide, please. This shows that we were able to achieve measurable reductions in risk across 5 key factors following our targeted interventions, including improving drinking water quality, reducing E. coli levels, and increasing hand washing practices. Of the 339 prioritized interventions, 154 were implemented across water systems, land use management, hygiene, and the notable progress achieved despite challenges such as delays in sanitation infrastructure upgrades. The cross-sectoral approach spanned the different scales, addressed risks from watershed to household levels, incorporated nature-based solutions alongside behavioral and infrastructural improvements. And this integrated strategy highlights the potential for long-term system health improvements, although with variable impacts and timelines influenced by the socioeconomic and geographic context. Next slide, please. In all of this, it's important to recognize the critical importance of nature conservation as a public health intervention, as part of which we partnered with several conservation NGOs, and one of the great outcomes has been the commitment by communities within several watersheds to establish large forest reserves, as seen here on the island of Overlau, protecting the headwaters, serving all the downstream communities. And we're working on getting similar commitments across all of our watersheds. A bunch of recent studies demonstrate that the proximity to and the coverage of protected areas is associated with a decreased incidence of diarrhea, typhoid, and acute respiratory infection, and that children living proximal to protected areas have a higher weight for age scores and much less likely to be stunted. However, perhaps the most important and compelling narratives here is that nature conservation approaches are probably the most cost-efficient and effective means of preventing the next large pandemic. And the importance of nature conservation for pandemic prevention, as well as to achieve the vast multitude of public health and well-being outcomes, seems obvious. It's surprising how slow that narrative has taken to gain traction. Next slide, please. Focusing on the combined economic, human health, and well-being impacts across linked watersheds and downstream areas motivates action and leverages investments that result in co-benefits across multiple sectors. If you design appropriate solutions, it requires taking a multi-sectoral systems level approach that accounts for both the social and the ecological, with collaboration across environmental, agricultural, public health, water and sanitation, and hygiene sectors, and across the land-sea interface. This can be achieved through these place-based processes of co-design and implementation of portfolios of interventions across nested scales. WISH is an example, is a system model of cross-sectoral coordination, effectively progressing many of the sustainable development goals, but it does require sustained investment in interventions across the various nested scales to realize the full benefits, particularly for nature-based solutions like replanting riparian zones, which exhibit lagged responses. Next slide, please. This is just an acknowledgement that our project is funded by the Australian Government, Indo-Pacific Centre for Health Security, and Bloomberg Philanthropies Vibrant Ocean Initiative, and it's implemented by University of Sydney, Edith Cowan University, Fiji National University, and Wildlife Conservation Society primarily. It's additionally been supported with complementary funding from Gates Grand Challenge exploration grants. And this is a pretty full authorship list, because I wouldn't have been able to present any of this without all of these folks being part of the program. Next slide, please.
Thank you, Aaron. Thank you so much. And I was wondering, how long have you been doing this research? So you have now all this evidence that you have now gathered. How long have you been researching this?
This is about 20 years of work, to be honest.
I was already thinking that it was not done in 1 year.
No. So,
yeah.
No.
So this is also probably also, you need long-term research, you need long-term programs to actually find out what works, right?
Yes.
Yes, yes. All right.
Especially if you're dealing with trying to alter whole systems.
Yeah.
If you're trying to alter an entire ecosystem, you need to think in decadal scales.
Yeah, yeah. And what I really like about your contribution was really that nature conservation is actually a very effective way to prevent any further pandemics. And I think that's also something that needs to sink in the room and in the online, I think. So thank you for your message. And can we move on to Manal? Manal Schreidesh is here. Oh, sorry, Aaron. Thank you so much. We will come back to you, eh? We will come back to you. So Manal, please welcome. Manal works with the institute, the Swedish Institute for Environment, and also she is the partner manager at UNICEF and helping UNICEF to implement WASH programs in a climate-sensitive way. So can you please take us through the guideline, because UNICEF developed a guideline to make sure that you do it in a climate-sensitive way.
Sure, thank you so much. Very good morning for the people joining us here, and the greetings for the people participating online, for the online speakers and the online participant. Just to clarify, it might be a bit confusing for the people here to speak about UNICEF and the work and the guideline developed by UNICEF, but maybe if we go for the first slide. Yeah, IVL WASH Governance Group, previously known as the WASH Department at SIWI, who transited fully to IVL like in May this year, have a partnership cooperation agreement with UNICEF. We have 5 partnership cooperation agreements with UNICEF, which allows us to work globally. So during this partnership cooperation agreement, we managed to support building the climate resilience system in different countries. And in my presentation, I would like to highlight on the methodology and the approach that we usually use for building the climate resilience solutions. Since our session today is to spot the light on the interlinkages between water, climate, and also health, I took this snapshot from UNICEF strategy, which is in line with the SDG Agenda 2030. As you can see in the snapshot, it's clearly mentioned that we have to work cross-sectorial, meaning that we are water actors, we are water engineers, we are water practitioners. However, we have to work and coordinate with other sectors, including health, but also education, agriculture, etc. And to do that, UNICEF developed the climate resilience framework, as you can see in this slide, which has consists of 4 processes. Professor Iron, at the very beginning, he's been talking a lot about the climate science, the climate change, the identification of the risk, which is part of this circle, which is the first part, as you can see here, understanding the problem. We need to understand how climate impacting water and sanitation and how this link to the human health, right? So this is the very first quarter of the cycle to identify the problem. And then we need to take it a step forward, which is the action. Yesterday's series, I think, focused more on identifying the problem, as Professor Iron summarized at the very beginning. But today we need to talk about the actions and how we can develop, together with the government and the responsible institution, an action plan or roadmap for improving water, sanitation, and hygiene in the countries. I think I'm under time pressure, so I will go directly to the point. Most of the NGOs or institutions that works on in water projects, I think doing a stakeholder mapping is very basic step, right? Like, it's the very preliminary step that we have to do when doing any work. We have to identify who's the stakeholders that should be engaged in the process. However, I think for me this is the most critical and the tricky part of the process, because you need to ensure that you engage the right stakeholders and you agree with the responsible institutions on the level of the analysis. Again, back to Professor Iron's presentation, when he spoke about the watershed level of solutions and the identification of the climate impacting the watershed. We, for example, in the last process when we supported Afghanistan, I think this is the last process I managed to support building the climate resilience system there. It took us a long time to identify the level of the analysis. Should we go for a river basin level for the identification of the climate risk? Should we go for, take it at the very beginning as a sectorial related and identify the risk and speak to the sector? So at the end, we managed to agree that we have to identify the risk on a basin level, and then the action plan, since the action plan or the roadmap or the actions that should be taken to address these solutions should be on a sectorial level, because the setup and the organizational setup of the country speaks to a sector. So the second step of I'm still in the first part of the cycle, which is understanding the problem. So first we need to identify the need and the stakeholders engaged. Second, we have to address water, sanitation, hygiene policies, and also climate. And we have to see how water policies consider climate. Looking, for example, I took this example from Jordan as a quick example as a Jordanian, but if you look at the national policies in Jordan, the climate and water sanitation policies, I can say that we have very good and great policies. There is very clear interlinkages, and you can see health is also part of the discussion and part of the game. Let's say it's clearly mentioned in the policies, and the interlinkages between climate, water, and health is clearly mentioned in the policies. Worth mentioning that part of the process for building a climate resilient system is to, in some cases, we review the policies to contribute to the NDC review. And like in Afghanistan, we managed to have clear evidence and the clear actions to be included in the NDC. And we do that as part of the process. This, again, back to the stakeholder, this means that we have to engage, for example, the leading international organization who's engaged in the national determined contribution review, like UNDP or other active stakeholders, or the Ministry of Environment, which is another stakeholders in the loop. The third step, which is the identification of the risk, according to the methodology that we usually use, that we have to look at the risk from 3 different angles. The hazard, we all know the hazards: drought, flood, sea level rise. But then the second step that we need to identify how this hazard impacting impacting population, impacting water resources, impacting water sanitation infrastructure. So this is the second part, which is the identification of the exposure, and then at the end is the vulnerability. We need to address on a national, local level, the vulnerability of the community, the people, the vulnerability of the infrastructure, because the more the infrastructure is vulnerable, then it's impacted and it's highly exposed to the risk, right? So there are, as you can see in this part, when looking at the vulnerability, there are 3 dimensions that directly linked to the health, which is the social component, the population, or the human, and the third is the environmental component. So these are the 3 elements that will help us to identify at the end how a climate impacting water and sanitation as a sector. And I keep mentioning sector because for me it's a sector, it's not only a service. In some cases, like people see wash as a service, but we, in the way how we analyze water and sanitation, for us, we work on a national level and we help improving water, sanitation, and hygiene as a sector. With that said, we are done with the first part, which is the identification of the problem, and then the second part, I think I'm around with me, okay. With the second part, which is the identification of the actions, of the solutions, sorry. Looking at the solution, it's very important to mention here, usually the risk impact local level, and we see the risk of a climate impacting population or the human or the wash infrastructure on a local service provision level. However, the solution should be national, might be related to the national setup, like improving the national policies or improve access to climate finance. 3 minutes? Or 2? Okay. Improve access to climate finance. Dr. Iron at the very beginning mentioned about the watershed. The second level of the solution is the watershed solutions, which, for example, the implementation of water and sanitation safety, climate resilience, water and sanitation safety plans is one of the actions that help protecting the watershed and the water resources on watershed level. The third level of the solutions, which is the project level, maybe to highlight that since UNICEF has and IVL part of the SWA Climate Task Force, so we also considered SWA, Sanitation Water for All dimensions for developing the solutions. So looking at these dimensions, we should look, when looking at the solution and develop a roadmap for improving the services and improving or building the climate resilience system, we have to look at the service delivery, we have to look at the governance dimension, we have to look at the environmental dimension, like the water safety planning, for example, or improving access to water and sanitation. At the end of this process, I took this example from Afghanistan because it was clearly highlighted that the impact of, for example, looking at a specific hazard like flash flood when coming, it will impact sanitation services, like overflow of sanitation services, which will cause a pollution in water resources or access to water. So this is a very clear risk, which is clarified in the risk in Afghanistan. Then the action is highly linked to the institutions engaged in the process. I missed to mention one point. Currently, we are trying hardly to engage like actors in WASH and institution like healthcare facilities. So it's very important part of the process. Maybe to close this discussion, at the end, doing the identification of the climate risk and building the solution will help us to support building WASH system strengthening, but also this is a very good evidence for improving the national policies, and importantly, to mention that this process is part of the Green Climate Fund guidelines, so this will help access to climate finance. Thank you.
And for everyone who would like to see the slides a little bit more in depth, we are going to share the slides. So that will actually help us also in reviewing, because you gave us a lot of information. It is complicated. So thank you so much.
Thank you. Thank you.
Shane Curtin, he is actually joining us online from Barbados, the nice island in the Caribbean. And he is officer in charge of environmental health and sustainable development from the Caribbean Public Health Agency. And Shane works on water quality and water safety plans. And Manal, she really explained to us about the guidelines and how do you take in the community and the different sectors along in the climate resilience building. He will explain more about the water quality and really the water specific sector. So Shane, take it away and please be careful about your time. Thank you.
Thank you, and good morning to all those in the room and all those online. Thank you for the invitation from the Caribbean to join in this very important webinar. Next slide. So I'm from the Caribbean Public Health Agency, and we are an intergovernmental agency. Just to share our mandate and also note that we have a new strategic plan 2025 to 2030. That's really about collaboration and working together across the health and other related health sectors across the Caribbean and with our international development partners. There are some key challenges that we face, and Aaron would have noted them very, very succinctly about the relationship between climate change and the environment, and climate change being just one of the challenges that we face. And at the Caribbean region, we know that we face significant burdens. And of course, there was a mention of the recap from the first session, which was one of the areas covered by Dr. Ruth Narang. Next slide. So in terms of the actions that we've taken to create climate resilient health systems, I must note the work that we've done on integrated water resources management. And in the Caribbean, we have created a action framework for IWRM, which is a request from our ministers of the environment at the very highest level across the region. Next slide. And these were the goals that we set out in this framework. And it's a framework that guides all of our Caribbean countries that are Caribbean member states, 26 in total. And these particular strategic goals, they include elements of stakeholder engagement, regional coordination mechanisms, national coordination mechanisms, actions that will improve capacities and frameworks for water within the Caribbean region. And this framework is what we use as a guide for all the work around water resources, which includes all of the different types of water. Next slide. Additionally, we have been doing some work on climate resilient water safety planning, as mentioned. And historically, as an agency, actually before the founding of CARFA, at the Caribbean Environmental Health Institute, we would have worked closely with the Pan American Health Organization over time to create water safety plans in many member states. However, over the past few years, the last 2 years, we've been working on introducing climate resilient water safety plans. And we've done these for Barbados, Trinidad and Tobago, St. Kitts and Nevis is ongoing, and Turks and Caicos is ongoing. But we're doing it within the context of the water-related risk that are projected to increase with every increment of warming, the impacts that we face, we know that they're felt disproportionately by vulnerable people in regions with high exposure and vulnerability. there are some projected changes within the water cycle, and Professor Jenkins would have noticed some of those things. But there must be action within this particular sector to allow us to be more resilient. And in the recap, there was a mention by Dr. Rupnarine that we are not entirely powerless, and we can put particular initiatives in place to allow us to, as I said, be more resilient to changing climate. Next slide. As noted by the last speaker, we would have utilized the new framework. Of course, we're familiar with the multi-border approach to risk management. And this just shows, just quickly, for the benefit of those who will see the slides, some context. Next slide. But what we're aiming to do for the Caribbean region is to, in all our countries, have countries attaining the framework for safe drinking water, which includes, as outlined by the WHO, the setting of targets, having the climate resilient water safety planning, and then the independent system of surveillance. So we want that in all our countries, that there is the attainment of all three of these requirements. Next slide. And I just wanted to show how the work in the water sector within the agency, within the region, occurs across multiple areas, and how it's integrated into our other surveillance systems. And Aaron spoke about how difficult it can be to make the case for conservation, environmental management, and a lot of work in that sector being related to public health. It's taken some time, but we're seeing in the Caribbean region how we can use data from these environmental sectors to support our surveillance objectives within the public health realm. Next slide. And this is a little bit fine, but I wanted to also show how the data that we collect on the side of water quality can be integrated with water-related infectious diseases to create appropriate surveillance that allow us to see what is the relationship between water, also climate, and health. Final slide. And this slide also looks at how we integrate wastewater data, which is a growing area of international surveillance. But in the context of climate change, where many of our countries might be water scarce, Barbados is one of those countries, and how the use of wastewater can be important to our survival in most cases. And countries are putting in place mechanisms for wastewater reuse. But in addition to the use of wastewater, we also can use this particular tool to allow us to surveil our communities. It's something that was very widespread during the COVID pandemic, where persons used it as a tool to monitor the presence of COVID in populations before cases would have arisen. So I just wanted to also include this, though it's not potable water or water quality. It shows how an additional water source that will be useful in the climate setting is also under surveillance within the Caribbean region. So I just want to say thank you for having me, and looking forward to having your questions.
Thank you, Shane.
Thank you very much.
Thank you, Shane. And really important that we also capture the data. So I think that's a really important point that you're mentioning. So now we have online Chilekwa Christabel Mibenga. She is the climate health expert in the Commonwealth. And she helps now governments of the Commonwealth to access climate finance through the Access Finance Hub. And Chilekwa, sure, you're calling in from Mauritius or from Zambia? I'm not sure. But I know that you did work at the Zambia Ministry of Health. Chilekwa, please go ahead. The floor is yours.
Thank you. And hi, everyone. My name is Chilekwa Mirenge. Like has been introduced, I'm the Climate Finance Health Advisor for the Commonwealth. I'm Zambian, but I'm based in Mauritius, where our finance hub is located. Thank you so much. We can go to the slides. So I will talk to you on issues regarding how we are working as the Commonwealth in terms of our policy integration in WASH, particularly on climate-related issues. So some of the first bit of the slides, I believe we already know, so I will just run quickly through them and focus more on what we're doing as the Commonwealth. I believe it's important that we all acknowledge that climate change does really affect water availability, and that's why we are now talking about it and how we can better integrate it into these WASH policies to ensure that there's a resilience in the sector. And also that when we have policies that are coherent, we ensure there's integrated planning across environment, health, water sectors and other sectors that need this. And in our role, this is what we're working on. So when we are pushing on plans and policies for the governments that we're working with under the Commonwealth Secretariat, we ensure that there is this a policy integration, and also issues to do with health really put into consideration as they are working on their policies. Like now, they are working on, most countries are working on their NDC 3.0. And our role is to ensure that issues of health are considered into that. And you've seen that from most of the countries that have been doing their NDC 3.0, issues of wash and water quality and quantity have actually surfaced in those plans. And also to take a cross-sector approach to ensure that there's that really integration between the different sectors, and understanding that these sit in different areas. And for us to get our goal, to reach what we want to do, we need to have that coherence and sector collaboration to ensure resilience. Next slide. Okay, so why it matters. Of course, these are the issues that we are talking about. I think where there's no water, or where water is scarcity, where the quality has been reduced, the quantity has been reduced, we see the surgence and resurgence of waterborne related diseases, and we know what that does, how it devastates the water sector, the health sector in particular, and also where you have extreme climate events, how that also affects the water supply and wash services. So if you have a health facility that has inadequate water supply, we know the challenges that come with that. So in our work, we need to ensure that there is integration at all levels of planning, at all levels of policy development. Issues to do with WASH and climate change needs to go hand in hand, and they need to always be integrated from the planning stage. Okay, so the benefits, I think these have already been spoken to, but it's important that we know and appreciate that. What is CIFA? So when we talk CIFA, CIFA stands for Climate Change Finance Access Hub. It's under the Commonwealth Secretariat. We have our hub headquarters in Mauritius, and we have 3 regions where we currently are working in. We have the African region, the Asia Pacific, and the Caribbeans. And in these regions, in the countries where we're supporting, so we particularly support SIDS, the small island development countries, and the vulnerable states under Commonwealth. we support the countries to ensure that they integrate health into their climate planning. And at country level, we have the climate finance national advisors who work with the governments of those countries under Ministry of Environment or Ministry of Planning, whichever is responsible for climate change. And with that, at the regional level, we have the thematic advisors, where I fall as a health advisor and a gender advisor. So our role is to ensure that as these countries work through their plans, they focus and align climate policies with health and WASH outcomes, and also to promote a multi-sectoral collaboration and climate resilient health sector. So when we are working with the countries, we ensure that we have this, like I mentioned earlier, the sectorial collaboration and working together of the different sectors within the country. So SIFA works through the countries with the national advisors, and I support the health part to ensure that the policy integrates climate change issues, which also brings on board WASH outcomes. So the mandates for SIFA, I can summarize them in 3 parts. The first part is that we do provide technical assistance to the countries to ensure that all issues related to climate change are well addressed. I think one of the most challenges that we've seen in countries is the lack of capacity or technical understanding in some of the issues. For example, when it comes to pipeline development of projects, maybe they're making a proposal to the GCF and they may not really understand what needs to go into there to make it a bankable project. So our role is to ensure that we build capacity to the teams that are putting up these pipeline projects, to ensure that at the end of the day, we access that funds, which will be used in 3 streams. So we do support the implementation and adaptation, climate adaptation, climate mitigation, and we also have cross-cutting issues. I did mention that we also incorporate gender now. And also the issue of policy coherence. I mentioned that it's also one of the big mandates that we have. And so far, as of this year, supporting the countries, we've managed to help the countries mobilize over $490 million to implement these different climate-related program and projects, which are related to the countries that they are working on. Okay, next slide. I can't see that. Can you make it? Yeah, so SIFA's approach to policy coherence. So I did mention that it supports health ministries to participate in climate planning. Currently, we are supporting them in their NDC planning and also their NAPs, and also ensure that their health NAPs are in place and builds capacity, facilitates joint programming and investment, and also encourages climate health WASH integration into national budgets. So these are the main things that we are using as an approach to ensure that there's policy coherence in our countries. Last slide. So this is just an example that we've given. I won't read that, but just to mention that among the countries that we're working with, we have Namibia, which is in Africa. And among the things that we've done to support Namibia is to ensure that issues of WASH, issues of climate change are integrated in their policy. So when you pick the Namibian water sector policy, you will see integrations of climate change in there. So in our work, we do work with the national advisor and the government sectors for the country to ensure that at every stage of their process development, there is integration. Health is not left behind. Health is always there, because we believe once that is integrated in the policy and the plan, it's easy to access or to lobby, to mobilize funds that are required to ensure that this policy is successfully implemented. And lastly, the last slide.
I am asking you. Yeah,
yeah,
thank you.
I'm done.
Yes.
Yes, thank you.
Thank you, Chileko. And I'm glad that we are sharing those slides because there's so much information and we really don't want to miss that. So, and I really got from you, Chilequa, your policy coherence, and I'm quite impressed by your results on how much finance for climate and health you have been able to secure. So we should really learn from your experience. Before we go to the Q&A, we have our last speaker, Chris Arora. He is a professor in veterinary virology in the West Indies in Trinidad Tobago. So also he is in this very early morning hours. And Chris, welcome. You are working with a new generation of students, really changing their mindset and making sure that they are working in an interdisciplinary way. So please go ahead. Floor is yours.
Thank you very much. I hope you can hear me fine. It's a great pleasure to be here. So if we could have my slides, that would be great. Yes, so we're actually working with professionals. We're developing cohorts of professionals within the climate change and health field. And I'm going to be talking to you today very briefly about how we're empowering Caribbean action for climate and health. Next slide, please. So whether it's ecosystem health, global health, planetary health, One Health, we're all really in the same boat. We're finding solutions to these difficult cross-sectoral problems affecting human, animal, agricultural, and environmental health through a transdisciplinary, collaborative approach. Next slide, please. We've heard a lot today about the different challenges we faced related to climate change, food and water security, zoonotic diseases, antimicrobial resistance. So we all understand the urgency to act now. Next slide, please. Whatever we're looking at, we've heard a lot today about the importance of an integrated response. And that's what we're doing by developing this cohort of professionals with the knowledge and skills to be agents of change. We're making sure we represent people from all the different fields, be it human input, academic input, environmental, social, economic input, input from the private sector, the NGO sector, the government sector, the animal sector. We need, if we are going to make an effective action plan for many of these really complex problems, we need this multidisciplinary, multi-sectoral approach. Next slide, please. It's all about teamwork. Next slide, please. So what we've been doing in the Caribbean for the last, 12 years now is we've been developing champions across the region. We've been building networks of professionals, the people who can really support the change that we so desperately need. And you can see this word cloud here. This represents some of the sectors and some of the disciplines that are represented by our fellows from 13 different countries. And we're enabling and empowering these professionals from these multiple sectors and countries to really lead and implement change following a One Health approach. Next slide, please. Here you can see on the left that we've developed a One Health leadership series, so with 30 One Health leaders from 12 Caribbean countries. These are professionals in really positions where they can effect change in their countries. And on the right here, the Climate Change and Health Leaders Fellowship Program, which we're running at the moment, where we have 24 climate change and health leaders from 13 Caribbean countries. Next slide, please. Here they are, here are the people making relationships, building relationships, which is what it's all about, so they can support each other to effect change. There's people here from all the different disciplines, all the different sectors, who all are making friends and getting to know each other. Next slide, please. What we've been doing is we've been running a part-time 12-month blended learning curriculum directed program, 6 fellows per year. And this involves an introductory and a summative workshop where all the fellows come together, because this relationship building is so important if you're going to support and help each other in these endeavors. And then every week throughout the year, we have themed online teaching sessions, framing climate change and health, so getting a common vocabulary and shared concepts among the fellows, leading change, working with others, sustaining change, and then action. And during the 12 months of the fellowship, the fellows have the opportunity to implement a nationally relevant climate change and health focused project and lead a workshop and symposium in their home country. So they build those networks within their home country. They also have the opportunity to spend a week in a CARICOM climate change and health regional agency so they can deep dive in a particular area. Next slide, please. So you can see here some of the examples of some of the projects that the fellows carried out, and I'll leave you with these slides. All sorts of different areas, improving public health through sustainable ecosystem management, waste management in hospitals in Haiti, working within schools in St. Lucia, developing community vulnerability and assessment tools, water vulnerability and assessment tools in indigenous villages in Suriname. Next slide, please. And another example of the second cohort, looking into gender-based violence in times of disasters, working to develop climate change and health policies in Trinidad and Tobago, a readiness assessment for farmers in Jamaica, leveraging partnerships towards WASH, the health sector in Jamaica. So really important projects that have big crossover amongst many of the Caribbean countries. Next slide, please. So just my last slide really is reflections of what we've learned over the past 12 years from this important work. How do we maximize the learning opportunities? Because we're dealing with experienced, knowledgeable and busy, stressed adult learners. These aren't students. These are people working in positions in high levels within their ministries, etc. So we need to make the learning fun and useful and enable them to build relationships and friendships. We need to run an adaptively managed curriculum, which is based on what the fellows bring to the program, but also what they want from the program. And we bring in local experts, so experiences are grounded in real local realities, so that we tie the learning to tangible real world issues. And we're solving real world problems with a learning by doing approach. For example, in the national projects where they come back every week and they talk about their projects and their challenges and what they're doing. So a maximizing opportunity for practicing what they've learned, opportunity for peer-to-peer learning, and opportunities for learning through shared experiences throughout the program. Next slide, please. So thank you very much for listening. If you want to learn more about what we're doing around One Health, please feel free to download this book, the link that you'll have in your slide. And if you want to learn more about our Climate Change and Health Fellowship program, there's the link here. Thank you.
Thank you, Chris. And I think it's really important what you're telling us, because you're saying you need friends to make sure that you create change. And we are here amongst friends. At least that's what I hope. We all want to make a change. And we all realize how difficult it is to make a change. It is multisectoral. It is multi-stakeholder. It is actually among so many disciplines. We're talking about animal health, human health, environmental health. We're talking about academics, and then we are talking about practitioners who are doing the work in the fields. So, I mean, we are talking about so many things. So there's no easy solution here. So we are not going to try to say that to you. That's impossible. But we do know that we need each other, and that together we can create that change. And I would like to allow for some questions from the audience. Somehow online there's a problem with asking Q&As, I understood from Isabel. Maybe here in the room, Manal, if you want to join me, if there's any question, please feel free. The people are still online, even the people from Barbados and from Trinidad. So please feel free to ask a question. If there's no question from the audience, I do have one for you, Manal. Because you explained it is about stakeholder analysis, right? And also when I hear Chris talking, when I heard Shane talking, it is difficult to choose the right stakeholder. And before you know it, you're talking with so many people that you cannot come to a solution. So you have been working in Jordan and explained that it's difficult to find the right stakeholder mapping, or to do the right stakeholder map. Can you just elaborate a little bit more on that? You can use this microphone.
To be honest, the difficulty is not in Jordan. As a Jordanian, it was the easiest country to work with, because we work in many countries. But generally speaking, I mentioned in my presentation, the very first step is to identify your level of analysis, and importantly, before identifying the stakeholders, to understand the institutional setup of the sector. Who provide the service? Is it water companies? Is it public-private partnership? What is the role of the Ministry of Health in monitoring water quality? In some countries, they do monitoring. They go they do monitoring on the water quality, and they act as a regulator and regulate the quality of the water. So you have to understand the setup of the sector, so you can identify the right stakeholders. And in some cases, I would say that it might be challenges to bring, for example, stakeholders from different like the climate stakeholders. In some countries are Ministry of Environment or other UN agencies that work on the climate. So to have them all sitting at the same place, have the same actions, working in the same direction, need efforts. It's not hard, but need efforts.
Yes, yes. It's also a state of mind.
Yes, exactly.
Yes. Actually, we come back to Chris with getting your friends right, getting your group of friends right. Isabel, anything online yet or not? Okay, all right, okay. Oh, there we have a question. Can you please state your name briefly?
All right. Hi, good morning. I'm Jin Dupont. Thank you so much for this interesting session. This is a question mainly for Aaron. Something you said about conservation as a public health intervention. I'm wondering if that becomes sort of the narrative that you have to conserve for public health. I mean, I agree that's true, but then I wonder if we kind of go back to the same narratives that brought us to like these climate change effects in the first place, as like you have to conserve nature because of human benefits from nature. So I'm kind of wondering what your take is on that. Thanks.
Aaron, are you still with us, Aaron? Did you get the question?
Yes, I am.
Great.
Can I put my video on?
Yes, you're here. We see you.
I'm here, yes.
Oh.
Great. That's a great question. This is, I think we need to think about systems health as opposed to the health of people per se. And if we think about the health of whole systems and how we manage those for the co-benefits to all of the stakeholders, and that's those stakeholders are the human and the non-human, and they're the organic and the inorganic. I don't want to get too philosophical, but the point is that if we manage whole systems of which we are a part, then we can affect our own health and well-being. But we can also affect the health and well-being of, you know, the other aquatic organisms, the land organisms that exist, and to consider that as the system is composed of both organic and inorganic components, both what we consider to be living and non-living, that we're trying to establish a functional system, a healthy system, as opposed to just prioritizing the health of human beings per se.
Thank you. Other questions in the room? Yes, Aaron, other Aaron.
The other Aaron. So I'm Aaron Salzberg. I'm with the Scientific and Planning Committee here in Stockholm, and I'm wondering, both Aaron, Chris, and maybe some of the others could reflect on maybe three elements of this. And Nanika, you mentioned that we're dealing with a really complex interaction of different systems. And often those interactions lead to emergent problems, not normally the way we think of problem solving, which is cause and effect, but new problems that emerge that we never thought of. And so that, to me, represents a real challenge in how we educate people in getting them to think differently about solving problems in these complex systems. So that's one. The other is the timeframes involved. And I think Aaron mentioned the fact that some of these, you might not see your results, for a decade or two afterwards. And I'll come back to why I want you guys to reflect on that. And then the third is relative risks, which is how do the risks that we're seeing emerging from these interactions compare to other health-related risks? And what I'm hoping is that you'll talk about these things from the lens of not just the potential solutions, but also what does that mean in terms of gaining financial and political support for these types of initiatives. I can imagine, for example, most political timeframes are shorter than the decadal cycle, and if your project can't show results in that political timeframe, your political leadership might not support interventions that work at that timeframe. The same might be true with relative risks if it doesn't get, isn't prioritized high enough within the overall response. So I'd love to hear our speakers reflect on how we motivate our political leaders to adopt some of these changes, and how do we train our practitioners to better address emergent challenges and risks that we're seeing from these complex systems that we might say are one thing today, but may be completely different tomorrow.
Yeah, that's a very, very good question. So Aaron and Chris, can I ask you to reflect on that? First, Aaron?
Sure. I think the first answer that I can think of is that in the way in which money is programmed for interventions within government, we have to be able to take a specific amount of resources and divvy that particular resources within a term of a government and say, there are things that can be spent immediately. There are things that can have an immediate effect, such as providing soap and clean water. There are things that are medium-term investments, which is things like fixing the toilets and cleaning the drainages within communities and managing livestock out of the waterway. And then there are longer term interventions, such as like replanting the riparian zones along river edges to prevent flooding and to help filter bacterial pathogens. And that might be a longer term investment. But in the suite of investments that are done by a government at any one time and within the term of the government, that to be able to say, we will invest in all three of those immediate, medium, and longer term things in equal, or we will at least be attentive to all three in our investment.
Yeah, compartmentalization, actually. That's what I hear. Yeah, great, great. And Chris, you are training those students, right? How do you deal with this in your curriculum?
Yeah. Oh, sorry. Yeah. It's. I hope you can hear me.
Yes.
Yeah, it's a great question because these complex problems that we're facing, as the speaker said, bring with them many unintended consequences along the way. I mean, which need to be taken into consideration if we're going to address the problem. There's no point in solving one problem and then developing another problem because of how we've developed it, like pesticide use and things like that. And I think what we've been trying to do with this fellowship, where we've been empowering fellows from these multiple disciplines, I think it's so critical that we have that experts within all the different fields that are able to input into these areas, so we understand those unintended consequences and the and the impact, the potential impact on them. So it's really making sure that we're giving these guys who are going to be making those kind of decisions in these complex systems, as Aaron was saying, systems, to have the knowledge and skills, not only themselves, but to have people who they can call up and they can talk to who have those skills, because we can't all have all the skills in the world, have those links, have those networks. So they can then say, yeah, if you do this, it's going to cause this. We need to get our heads together and make sure that we don't make one thing affect another. So it's all about training and empowering so we understand those impacts. Otherwise, we can cause more harm than good when we're addressing an individual problem, because we have complex interconnected problems that we're facing. So that's what we're trying to do within the fellowship program, is give them these skills.
Great, Chris. And I was thinking, Chilikwe, if you're still with us, Chilikwe, you work with those governments in developing those developing the climate resilience programs, right? And I can also imagine that your policymakers that you're dealing with, that they might also want direct results, while some results will take a long time, and you have to think long term. What do you do to engage them?
Thank you so much, and that's very, very important. And I think it's one of the challenges that we've really encountered, I think, when trying to put some of these things, how to make the linkages and also to show the direct results that will come from this, the core benefits that will come from this. I think that's why it's important to start with them from the initial goal. So how we engage them, we work with them through their vulnerability assessments, where you pick these issues as they come, so that, for instance, if there is climate sensitive diseases that you identify during your vulnerability mapping, I think after an intervention, you should be able to see whether those diseases are still going up, how is their prevalence, and so on. So that is one of the direct things. But I think it's important to have this continuous engagement with them to show them the direct link. And then I think the other thing that also comes up is the issue of indicators. How do you show the linkages that this is what has actually come out from this climate variability, and this is the impact that it has on health. And once we do this, the direct results will be this. So it's important to set your baseline well by looking at what indicators you have, and also the vulnerabilities that are there in the country. So we start at that level, build the baseline together, so that you are able to monitor any progression and any change in those variables that you would have agreed on at the beginning.
Thank you so much, Chilikwe. Thank you all for your questions. We're now going to Omar El Hattab. He is in Nairobi. Hi, Omar. Omar works with UNICEF, and he has a very difficult task to close this session, give us some final reflections, and I leave this floor to you, because I know this is difficult. I wish you luck.
Thank you very much, Hideki. A very good morning, good afternoon, and good evening, colleagues. It's a pleasure to be among you here. My name is Omar Al-Hattab, as Hideki had alluded. I'm a senior advisor for WASH in emergencies and fragile contexts with UNICEF, working here at Nairobi HQ. And it's a joy being among you today. Well, as you may recall at the beginning of the session, Aaron summarized the conclusions of the first online webinar delivered on Sunday. And in that session, presenters provided an initial introduction to the nexus between water, health, and climate by exploring the connections between water, climate, and health for better understanding how these complex systems interact and the impacts they can have on human health and other interconnected determinants. Today's session focused on the actions based on which I've summed up a few key messages and recommendations. First, we need to bridge the gap between science to policy and action. Considering the climate hazards, heat, floods, droughts, vectors, contamination, we have heard today unproven water-centered solutions to protect health. Secondly, climate change is predominantly felt through water, the too much, too little, or too polluted. And climate resilient WASH is the first line of defense. And that requires risk-informed planning, resilient design standards, redundancy, remote monitoring, sustainable services and financing. Thirdly, we need to break and bridge the silos and work across sectors, as Chris had alluded to. WASH services are interrelated with health and other outcomes, and improving cross-sectoral coordination and integration, in particular with areas such as Water resource management is critical. Partnership is a critical multiplier. Health, water, and climate sectors must plan, budget, and work together. 4. As part of that cross-sectoral approach, there's a need to strengthen public health systems with a One Health lens. One Health acknowledges that the health of humans, animals, and the environment are closely linked and interdependent. This is needed to better link water quality, environmental, vector, and clinical surveillance, including wastewater-based epidemiology to early warning and response. 5th, adaptation of policies, and this is really critical. There is an urgent need to embed health and WASH in NDCs and NAPs and other climate policies and strategies. At the same time, there's a need to incorporate climate in national policies and strategies in both the WASH and health sectors. This is vital to unlock climate finance alongside domestic finance at a time of constrained ODA. Let's not leave people behind in this journey. There is a need. I mean, the world is becoming incredible. It's so fragile. There is a need for more equity and focus on fragile contexts, which is predominantly, one way or the other, the entire world, which often are the most vulnerable to climate change and disease outbreaks. Prioritize marginalized and crisis-affected communities, ensure safe WASH in healthcare facilities and schools, designed for gender, disability, and protection. Build sustainable services for the long haul. Consider life cycle costing, asset management, utility and service performance, and build local capacities, because building resilience is often a no-regret solution that not only addresses climate change, but also other shocks. Building on the same point, consider other co-benefits, including reduced disease burden, reduced health expenditure, safer care delivery, cooler cities, and cleaner waterways. Investing in WASH resilience brings about health, socioeconomic, and environmental gains. Finally, mind the mind. Recognize other collateral impacts of climate and health and WASH systems, such as the mental health impacts of climate shocks, and design WASH and service continuity to reduce stress and enable recovery when shocks occur. Now I'd like to remind us all that solutions are available. They're there. It's equity and scale that are the test. And we don't have the luxury of time here because, as Aaron had alluded, it's hitting us. Let's use the excellent examples and proposals presented today and also use other solutions proven by the organizations like UNICEF and other contexts to scale them up and contribute to a system-wide adoption. Finally, I'd like to really, from the deep of my heart and the bottom of my heart, I'd like to invite participants to identify something that might have resonated from today's session and take it back to your teams and countries. I also look forward to seeing you tomorrow for the final seminar. The topic will be Advancing a Health Agenda in Our Climate Response, where we'll take stock of the discussions of the previous sessions and lock in the WASH and health forward priorities for climate policy and finance. Last yet not least, I take the opportunity to extend my sincere thanks to all speakers, Isabel, Naneke, Aaron, Manal, Shane, Shilekwe, and Christophe for their invaluable contributions, to the conveners of this seminar, AMREF Health Africa, Ministry of Foreign Affairs, Kingdom of the Netherlands, Commonwealth Secretariat, UNICEF, WHO, and IFRC. And special thanks to all the attendees for prioritizing this session in your busy schedule. I really hope you find it as interesting as I do. I wish you a pleasant day and a great week ahead. And thank you so very much. And the floor is back over to you, Hideki. Thank you.
Thank you.
Thank you so much, Omar, for stepping in and doing what Nanika said is difficult, because trying to summarize 1.5 hours in just a few minutes is, just difficult. You did very well, so thank you so much for that. You already also kind of teasered what I'm about to say now, because as you said, we need to really bridge this gap of like talking the evidence, the actions, and then moving it to somewhere where we can actually do more of it. So talking about the political agenda, talking about how we can increase finances, and also how do we even monitor what we actually want to achieve? So looking at indicators. So all of this is what we want to do tomorrow morning, also at 9 a.m. This is an in-person event only, but we still hope that you'll be with us, everyone here in Stockholm. So I want to definitely invite you, can you see that? To join us for this third session within the seminar series. And of course, I also would extend my gratitude, just as Omar just did, to all the co-conveners, to all the speakers today who've joined us from various locations worldwide, also here in Stockholm though. And also thank you to Nanneke for moderating us so well throughout this session. I hope you have a great rest of your day at World Water Week, and hope to see you tomorrow. Thank you.
Well, thanks everybody.